会有更多的朋友陆续的进来。
燕霞是不是给利民这个 co-host？他这样的话，他操作更方便一点。
王涛，你看一下那个利民现在 lost his co-host，我来做 add meeting。我们也有那个 student co-host，可以跟我们来 add meeting。哦。
对，两个同学进来了。
好极了，谢谢我们的student co-host。
Wendy 还有温馨，我把它们编一下。
王涛、王大夫，请给利民 co-host， 这样的话他操作方便。
利民是 co-host。好极了，那我们现在就准备开始了，8:02了。好，谢谢大家今天晚上
Recording in progress。
好，来花宝贵的时间来到联盟我们的这个讲座。我们呢今天晚上又很幸运的请到了于立民医生给我们做关于这个 artificial intelligence 这个人工智能在医学方面的讲座。在我们讲座开始之前呢，我先给大家简单的介绍一下北美华医联盟。大家应该能够看到我的 screen， 这个我就是从我们的 website 给大家介绍一下，因为我们最新的这个讲座还有联盟的具体的信息都在我们的网站上，这是我们的首页。大家呢可以看到，我把这个放得大一点啊。可以看到我们的讲座都是在我们的首页上。今天是于立民医生的这个 AI in Medicine， 我们明天呢还有一场非常精彩的讲座，是在谈新冠及其疫苗。我们这个网站还有这个lecture schedule 是在随时更新的，还有我们如果有重要的通知都会在网站上显示出来。大家可以到网站上去获取联盟最新的信息。这个 upcoming lecture 这个 OK， 今天是于立民医生来给我们讲 AI in Medicine， 然后这是明天的讲座顺便跟大家也要打一个招呼。我们这边呢有这个 Zoom links， 也有如果是 Zoom webinar 这个 registration links 也会在上面。我们呢给大家简单的介绍一下北美华医联盟。我们这个北美华医联盟简称华医联盟，英文是 Alliance of North America Chinese Physicians ANACP， 是于2016年3月份成立创建的一个非营利组织。联盟以服务会员为主，通过教育、讲座、知识交流为北美华人医生的社区提高病人服务水平，也提升医生的个人生活品质。我们的价值是 care， 代表 communication, advocacy and respect and excellence。这样呢，我们现在就还有一个请大家看一下呢，这个就是我们的以前的 lecture。我们的录像的链接现在都放在网页上，大家可以到这个 lecture series lectures 2023来看我们以前的讲座。这个再谈乳腺癌是我们上一周刚刚有这个的一个讲座，是上个周六的一个讲座。好，下面呢我就来介绍一下于医生。好。我把我的这个 sharing， 今天我们很荣幸的能够请到于医生哈。于医生呢 我现在给大家做一个简短的介绍，我用英文来介绍我们的这位于医生哈。Dr. Yu graduated from Nanjing University School of Medicine. He completed his APCP pathology residency and dermatopathology fellowship at the University of Michigan. He then worked at University of New Mexico and Diagnostic Pathology Medical Group in California. He joined Beaumont Hospital and Oakland University in Michigan in 2015. He was the medical director of pathology informatics and staff dermatopathologist at Beaumont Health System. He initiated the first ever informatic rotations for pathology residents at Beaumont Health System. Dr. Yu also has extensive experience in computer science. After his master's degree in computer science, he worked on a variety of commercial and academic computing projects, including the award-winning informatics system of high-throughput genome sequencing at Craig Venter Institute. Dr. Yu's current focus is big data and artificial intelligence in medicine. He is the director of pathology of PathAI. PathAI is a leading company of artificial intelligence in pathology. 我们下面呢就把时间交给于医生。立民，你那边可以 share screen 吗？
Yeah, it's such a great honor and to give this lecture at NACP. And thanks Yanxia for this introduction. So today's I'm going to talk about AI in medicine. So the big picture and the state of art. I have a disclaimer to make first. I'm a employee at PathAI. It's a Boston-based AI company. And all these views are going to express in this presentation just solely mine. Do not represent the opinions or position of my employer. And I'm going to mention some brand names and company names, but it doesn't mean that I sponsor or endorse those companies. I'm going to have cover two topics in today's presentation. One is FDA-approved AI medical devices. The second one is large and foundation models. So this is the first topic, FDA-approved AI medical devices. I want to make a clarification first. When we talk about medical devices, it's not only about the instrument, the medical instrument that you can see physically. Actually, all this software and algorithms also considered a medical device from FDA's perspective. FDA classify all the medical devices in different categories, class 1, class 2, and class 3, based on the benefit and the risk of those medical devices. Class 1 is considered low risk, and so there's no FDA approval needed. Class 2 has a moderate risk, and they need 510K and a pre-market notification, but it's still considered a lower risk compared to class 3, which is has high risk life supporting device, and the risk can be life-threatening. And all class 3 devices would require a pre-market approval, PMA, and this definitely takes much longer and also is more expensive. So that's the different classifications of medical devices from FDA's perspective. In addition, there's a de novo pathway for FDA. De novo here means there's something innovative, it's very new. And then because when FDA evaluate the medical device, they usually use a predicate as a reference. But if your device is very creative, very innovative, and there's no predicate for FDA to use as a benchmark, and your device will be considered de novo. In the wake of AI, machine learning, and big data, FDA adopted different policies to address the need for approval or evaluation artificial intelligence or machine learning softwares. So the first one is this action plan issued in 2019. So the other line is a potential approach to see we're going to evaluate all the AI devices on these 4 general principles. Number one, they said, okay, all these AI devices are expected to develop in a good machine learning practice. But what is considered a good machine learning practice is not well defined yet. And also there's a pre-market or predetermined assessment of SAMD, which is software as a medical device product that's required. Say they need a routine monitoring of the device product to determine when there's a change that need FDA's review. Also, this requires transparency and real-world performance monitoring after the device is released on the market. Then in 2021, there's another action plan issued by FDA. It's more like the continued build up based on 2019. It's re-emphasize the need to support the development of good machine learning practice to evaluate and improve machine learning algorithms. And now it's also want to foster a patient-centered approach, including the device transparency to users. In other words, the developers of AI or machine learning algorithms should release how they train the algorithm, what the data they used to their final users. And also they want to have a developing method to evaluate and improve machine learning algorithms. At last, they emphasize the real-world performance monitoring. Then again, in the 2023, is another action plan issued by FDA. So this is a shift from used to approve locked algorithm. Locked algorithm considered more like a static. And now the shift to a total product lifecycle. Given the nature of AI machine learning algorithms, because it's continuous improvement, have like an iteration and for new features or for better performance. So FDA said, okay, because of the how AI and machine learning algorithm is developed, we want to move to like a total product lifecycle, continuous review of these algorithms. This one is 2020, is 3 years ago. What is AI devices be approved by FDA? And this article take 29 devices because actually there's about 65, and also said the other 30 plus product are not real AI machine learning algorithms. So he focused on this 29 FDA approved. Then they categorized all these algorithms to see in the different specialties. One thing you can see clearly, radiology is the majority of FDA approved devices. The next is the cardiology. And oncology is the third one. The majority of FDA approved are through 510K clearance, which means it's class 2 medical devices. And only 5 received de novo pathway clearance. And the first FDA approval was granted in the year 2016, and then the 3 more in 2017. we're gonna see more in 18, then slow down a little bit to in the 2019 and 2020, or maybe that due to the COVID. Then that's the data from 2020. If we look at today's FDA approved list, you can find the list from FDA website. Go there, you can find all web list. There's in a spreadsheet, FDA approved AI or machine learning based medical device. And this summary of what this look like as today. The year-over-year increase of AI and machine learning enabled devices slow in 2021 and 2022. And based on the projected volume in 2023, the increase of AI machine learning enabled devices is expected to reach 30+%. In this new data also showed 79 of the devices authorized in 2023 are in radiology, 9% in cardiovascular, and 5% in neurology, and 4% in GI and urology, and so on. In addition to having the largest number of submissions, radiology has experienced the steadiest increase of AI machine learning enabled device submission of any specialties. So right now, radiology is really the hot area for AI or machine learning devices. That is not surprising, considering the standardized and availability of data in radiology. Radiology is the data, no matter it's a CT or X-ray or ultrasound, all generated on the computer. And then from the computer, it's easy, you can just fit it in machine learning or AI algorithms as an input. So that's why radiology is the area we see the most AI and machine learning devices. This is the breakdown of by specialties. Again, we see radiology, which is the pink portion of the pie. And there you can see the majority of them. And the yellow one is the cardiovascular. So which is the second most specialty in terms of AI and machine learning devices. And also there's multiple companies, they have a multiple clearance. You can see some very familiar names: GE, Siemens, Philips, Canon, AirDoc. And then that really comes to because those companies are pretty heavy in radiology. They are the most prominent radiology equipment manufacturers. So, and they can easily embed machine learning algorithm into a machine. So that we see these companies there. If you want to know more about individual devices, you can go to this website. They give you a individual like detail snapshot, snapshot of this algorithm. You can click into the individual dot. They tell you what is the device name, what it's about, what's the field, and when it's approved by FDA. So this website is give you a comprehensive list. And but not all AI claimed to be AI are real AI. So this the authors of this article, they went through the FDA approved devices, and they compare how those manufacturers market their products to see if there's a consistency or discrepancy between how FDA approved and versus how they market their devices. And then they break down in different subspecialties from radiology, anesthesiology, so on and so forth. And then based on whether there's a adherent, they can have adherent and a contentious, more like it's a borderline, and a discrepant. Discrepant really means there's discrepancy between how the get FDA approval versus how they market their product. Here is an example of a described device, and this is called Nova Guide 2 Intelligent Ultrasound. From FDA 510K summary said this device is a medical ultrasound system intended for use as adjuncted to standard clinical practice, and so on and so forth, to measure the cerebral flow velocity and the occurrence of transient emboli within the bloodstream. They never mentioned how there's machine learning or deep learning or AI, but in their marketing material, they said within cutting edge AI and advanced robotics. So that's the discrepancy on there. So something is for us to be aware. There could be exaggeration from the manufacturers or marketing materials. Okay, so I just finished my first topic. Just give you a quick review about the FDA-approved AI and machine learning product on the market. And we can see that radiology is the #1 specialty in terms of the number of devices approved. I'm going to switch the gear, talk about large and foundation models. I'm going to take a couple of detours in this part of my talk. So just please bear with me on that. So before talking about large and foundation models, I want to talk about what I talked last year. Almost exactly 1 year ago, I gave a lecture on AI in medicine to also NAACP. And at the end of that lecture, I summarized this trend in AI in medicine in 3 things. #1, platform as AI. #2, embedded AI. #3, multimodal AI. Platform as AI is more like the whole system. Think about like if you have Epic, then Epic can really function as the super brain to make clinical decisions. And this one, we haven't really seen that yet, but it's coming, all right? The second one, embedded AI, we see all the names, Siemens, Philips, and GE, they have the radiology FDA-approved algorithms. That's because they embedded AI into their machine. And the multimodal AI, we're going to talk about a little bit further. So that's what my summary in 2022. And I will see I didn't foresee that something big happened this year. I'm going to make another detour to talk about IBM Watson first. And I'll try to make a case here why the large and the foundation model is such a breakthrough compared to what we have a couple of years ago as IBM Watson. IBM really made a breakthrough when they won this competition, the Jeopardy, against the human, the best players in 2011. So on that, they make a IBM Watson to market their product in healthcare industry. They call it IBM Watson. So that has really make a big splash, make all this top news across different newspapers and magazines. So here's one from Fortune. Here's how IBM Watson Health is transforming the healthcare industry. Okay, that's in 2016. You see that. Next slide, 2 slides, I just copy paste from IBM's their own presentation. They talk about how they develop IBM Watson Health. They see how they parse all this natural language in medical literature body to put them in different categories like disease, symptoms, modified medications, so on and so forth, to pass this information out. Then they said, oh, IBM Watson is so good at NLP, natural language processing, and it has been very good at the broad domain of unstructured data. So it's the best fit for Watson is a problem that requires the analysis of unstructured data. And the critical questions require decision support and high value in decision support and the leverage skills to maximize machine learning and improve outcomes over time. That's exactly the perfect fit for medicine. Don't you agree? And then IBM Watson was trained mainly by Memorial Sloan Kettering oncologists. And then they use MSK oncologist expertise as the input and also as the monitoring of IBM Watson's performance. And there's no independent or third-party study that's solely based on at MSK. Then also there's a big announcement by MD Anderson because MD Anderson announced their moonshots and they're gonna use IBM Watson as the leverage for them to end the cancer. So that's also noticed that's the 2013. You can hear different stories by how the success of IBM Watson's and how fast they can make a diagnosis in a couple of seconds. And this is the story comes from India. But actually, I didn't believe IBM Watson. In 2017, in my talks, presentations, I said IBM Watson will not work. And the reason is not because I have crystal ball, and just because I know what's the state of art of this computer algorithm by then. So SQUAD is a competition that is more like our reading comprehension. It's use Wikipedia's articles, then let the machine to read the articles, then they answer the questions. So it's more like a reading comprehension that we already have in like a TOEFL or test or any like a GRE test. So that time, that's the state of art test. Let's look at the performance of IBM. That test is the rank is number 16. And there's a F1 score, which is the evaluation of accuracy, taking both consideration of sensitivity and specificity. Is only like nearly 71%. Then there's the claim made from a Chinese marketing material, seeing how fast they can read the books and articles. And if we see our best performance across that represents the state of art of human beings, that only 80% of computer to do this reading comprehension. And if 0.8 to the power of that many articles, what is the value? It'd be 0. So based on that, I didn't believe IBM Watson would succeed. I said IBM will not succeed. I don't care how many times, how fast it can read the articles. That will not convince me at all. And however, I mean, IBM didn't succeed, just as I predicted. But then I also said, IBM Watson failed, but we're gonna learn from the lesson. Something much, much more powerful will come. Although I didn't know what it is, but I said something big, better, more powerful will come. Then here we have a ChatGPT. And it's all start from the article. Attention is all you need. It's based upon our NLP, natural language processing. And because natural language processing, you to use the LSTM, long short-term memory, as a type of recursive neural network. And then they have this transformer, that's attention transformer. The major difference is in the RNN, all this attention build up is more like a sequential. In the transformer, which is the ChatGPT based upon, all the information can be in parallel. So that's a huge advantage, that how much information can be processed. And also, in addition to this software improvement, we have like a huge computing power with the help of GPU from NVIDIA. Then ChatGPT is not the first one of large language model, but it definitely is the become the name brand for this type of AI products. There are so many of them. Some of them are open source, some of them are proprietary, and they all have a thing in common, that compared to the prior models, all these large language models have a huge number of parameters. Okay, then for example, this ChatGPT 3 have 175 billion parameters. Think about it, each parameter is this knob in a cockpit. Now we have 175 billion knobs in this cockpit. So that's just a huge number. It's amazing. But that is not the highest one. You can have a Palm one is built by Google as have 540 billion. So that get more and more complicated. After the release of ChatGPT, naturally people think, okay, how about we do ChatGPT using in medicine? The first thing people like to try AI in medicine is to take a USMLE exam, as we all did. There's 2 articles talk about ChatGPT's performance on USMLE. And then it's one said, okay, there's AI pass USMLE, and they yield moderate accuracy and approaching passing performance on USMLE, and demonstrate a high internal concordance, and also has explanations, contains non-obvious insights. It's very encouraging to use ChatGPT in medicine. There's anecdotal stories. People really love anecdotal stories because so catching. And here it's like a 4-year-old boy and began developing concerning symptoms, including pain and start and growth. His mother brought him to 17 doctors and over 3 years, and no one could give them a good diagnosis. Finally, his mother took all symptoms, talked to ChatGPT to find an answer. And ChatGPT suggested the tethered cord syndrome. And then a doctor confirmed that. And then tethered cord syndrome is because the spinal cord is attached, stuck to the spinal canal compared to the normal case. So that's an anecdotal story about how ChatGPT helped this baby. ChatGPT is a very general purpose, the large language model. Then people would think, how about we develop a large language model for medicine? Then people tried, and there's this article from Google. Before MedPalm is this what the name for this algorithm. They have a Palm. Palm is this general language model, just like ChatGPT. Then they build upon Palm. They use instruction tuning and prompting. We can talk about a little more about prompting later. And also they develop this benchmark for using different database to as a testing data set for their product. oops, oh, here. And here is a different language models before MedPalm. And MedPalm, and then they called the PlanPalm, which is the instruction tuning one, have achieved a 67.5% accuracy of the USMLE. So that's very exciting. They compared different products. This one, the green one is the MedPalm compared to the generalized language model called FLANPalm with the clinician. It's the real clinician, just like you and me, compared to the MedPalm language model. And actually the performance is quite close. And they also compared the adverse event, including incorrect content, missing content, possible harm, and possibility of bias. So in this bar, the higher bar, the better. But in those categories from B to F, the lower bar, the better. So you can see in some of the categories, clinician definitely did much better than language, but not too far. And look at this likelihood of possible harm. It's just very comparable. Also, they evaluate the comprehension, retrieval, and reasoning capacity by clinician. So they have different tasks, and the clinician and the MedPalm, which is the green one, is very close. So that is the MedPalm from Google. And then not too long, they had another version called MedPalm number 2, the version 2 software. And this one even get even better. This one for USMLE, they achieved 86.5% accuracy, which is pretty amazing. But this one is, it's interesting from this article, I didn't find how they didn't give a good explanation how this improvement was achieved. So I suspect it may be a little bit like overfitting in this version of language model, just specifically for USMLE questions. Okay, Google said, okay, now we have a general language model. We have a language model for medicine. How about a multimodal foundation model for medicine? By multimodal really means a different form of data. You have natural language or unstructured data. For example, the clinician's note, the scientific publications, the books. And also you have an image like dermatology, radiology, pathology, and cardiology. That's all the image data. And even you can have some genomics data, right? How about think about if I can train a model to understand all this information, would that be awesome? So that is really the motivation about MedPalm M. M really here means multimodal M here. So they did 2 things in this publication. The first, the curation of multi-med bench, just same thing as what they developed for the MedPalm. This one used as a benchmark for their performance evaluation of the MedPalm M model. Also, this the keyword here is a generalist. Generalist means you know everything. Just like our family doctors, they know much more than any of our specialty doctors. So that's a generalized system, and that's Google's one. Okay, I'll give you tell a good story that the real story that what I did. Yesterday in a WeChat group, one of our alumni asked a question. She said, "Oh, my friend's mom had this cervical polyp. The pathology examination of the polyp revealed that there's a low-grade squamous intraepithelial lesion. So what should they do as the next step?" So I just type this question in ChatGPT. I said, you are a GYN doctor. Your patient is a 52-year-old woman. I don't know exactly how old the patient is. I just make assumption because based on my alumni age, I assume it's a 52. It's who had a cervical polypectomy, and the pathology examination reveals a low-grade intraepithelial lesion. Little was her first diagnosis of LGIL, and the patient had no history of high grade. So what's the treatment? So there's a question asked ChatGPT, and that's the ChatGPT's answer. First, I'm not a doctor, but in general, blah, 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 low grade. Then his suggestions, repeated cytology, HPV test, colposcopy, and treatment of lesion, blah, blah. And then also, I confirmed that with up to date, with considered with very reliable medical reference. It's very, very close. If I'm not a cytologist, if I'm not a guy doctor, I think this answer is pretty satisfactory. So it's a real story. And to give you impression, because I use both ChatGPT and also Google have similar product called the Google Bard, very similar. And I tried both for a while. Here's my impression. ChatGPT's answer is very formal, just like a scholar give you a very good, comprehensive, formal answer. And Google's product, just like software engineers, then you ask something, it give you something back. It's very useful, but in terms of the style, it's not as formal as a scholar as what ChatGPT gives you. So I think it's very interesting to see the contrast between the two large language models. Okay, now we talk about prompt engineering. We have language models that it turned out how to ask the question is very important. It's kind of like an art and a science to ask the right question, ask the question the right way. So actually, this like creates a new field called prompt engineering. It's the purpose of this field is just say, okay, how we can ask the best question so I can get the best answer from the language, from the model. So it really is the key to unlock the potential of a large language model. You can see all the different principles, what you should do, what the best practice you should do. For example, assign role. That's what I did for ChatGPT. I said, okay, you are a GYN doctor. And I can say, okay, you are, for example, if I make a travel plan, I would say, hey, you are the travel agent. I need to go like Tokyo for 5 days. What's my focus? What's my budget? And tell me what you should do. What should I do? So you give a rule, assign a role to the ChatGPT and be more specific. So all these come to say, okay, you need to know how to ask questions to get an answer. Then you can make an even more advanced way to ask questions. This one is called chain of thought prompting. So if you just ask a question without going step by step to give the language model example, how you solve the problem, the language might give you the wrong answer. This is, for example, what showed in the left. And you said, okay, Roger has 5 tennis balls. He buys 2 more cans of tennis balls. Each can has 3. How many tennis balls does he have now? So you tell language model, say, okay, the answer should be 11. Then you ask something similar question, then ask ChatGPT. ChatGPT gonna give you the wrong answer. In contrast, if you ask a simple question, the first question, but then you tell ChatGPT how you solve the problem. You say, okay, that's how we solve the problem. right? Give a step, then find the answer is 11. Then you're asking similar questions. ChatGPT learn from how you solve the question and to solve your question. So that is called chain of thought prompting. There can be some very complicated examples. For example, in this one, you say, okay, what's the other numbers in this group add up to an even number? You can see the answer yes or no. You give me ask a question, give the answer. The A means answer. Then ask another question, give answer. You also show them how you did this, how you solve the problem. And finally, you ask the question to ChatGPT or any other large language model, then they output the right answer because you show them how you solve the problem. There's other types of prompt engineering, such as a tree of thoughts. Then you can use like a decision tree-like approach, and even you can combine different output into one, like an ensemble fashion. So that is just examples of different techniques of prompting. If prompting is so important, how about for doctors? Actually, now is people really make an investment how to do, like to teach medical students, to teach physicians how to ask questions to large language models, right? This article is prompt engineering as an important emerging skills for medical professionals and prompt engineering in medical education. Boston Children's Hospital even hiring an AI prompt engineer for ChatGPT. And I don't know whether we have a doctor from Boston Children's Hospital in the audience. You can put whether you know how you know about this in the chat. Be interesting. Then there's guidelines how to use a prompt in healthcare. So there's definitely you can read these things, become better at asking questions. There's something we need to know about GPT. Not only ChatGPT and GPT or Google Bard or Cloud or any of these large language models. And all these models trained on internet. Actually, there's no core belief, and all these models have no belief. They just know how to generate the answer. They don't know what the true or false answer. And there will be mistakes for sure. And they call it hallucination. Sometimes ChatGPT give you an answer, it's with a very good confidence. Say, oh, I see, blah blah blah, but actually that's a hallucination. Just that's what ChatGPT makes up. So finally, the end user, if you're a doctor asking healthcare question, you are the gatekeeper, right? So there's no true conversation, but when you ask questions to ChatGPT, you can ask question A and follow up with another question. You get a sense of the conversation. Actually, just the ChatGPT just take your prior question and your current question together and answer the question again. So give you a sense, like a full sense as a conversation. Actually, it's not. Then there's people looking into the physician malpractice risk by using ChatGPT. And this is the article from JAMA. There's some of these claims about large language model. First one, a hallucination of LLM. Yeah, definitely. Large language models can make up the answers. So that's something to look out. Non-transparency of source information. We all know they train on the internet, but exactly how they train and what medical information they use is difficult to know. It's not transparent to us. Unspecified in medicine, yes, for ChatGPT, but for a MedPalm, we have a more medical-oriented large language model, and it's changing and evanescent output. That's true. If you ask him a question multiple times, sometimes the answer will be different from time to time. That's something also to be aware of. LLM not withstand real-world care decisions. So far, really, we have no study about how the LLM has been used in clinical practice in real world. And the USMLE really doesn't count, right? It's not a real-world practice. LLM should be used as a supplement to information gathering. Definitely true. And particularly if you are doing something a little bit beyond your comfort zone, and ChatGPT can be very useful. LLM should not be used as decision making, definitely, and you will be the gatekeeper. Also, you are the information consumer, and you are the gatekeeper. There's a movement asking for more regulatory oversight of LLM, but right now it's no real oversight or supervision at all, because it's so new, this technology. Yeah. That's a list of regulatory challenges related to the rise of LLMs. So like we are nearly 1 hour, so I'm will not go through them one by one, but just let you know there are so many challenges for LLM, the application in healthcare. That's the large language model. How about the other large models? There's a new large model, generalizable detection for retinal images. They have two types of ocular images. One is OCT, one is the color photographies. That's CFF and OCT. They train them separately, and then I use them to answer different questions and to test their performance. So that's one of the retinal image foundation model. I will not go through this quickly. Yeah, then here we have the pathology model. This one is from Harvard and MIT. And this foundation model is developed using 100 million tissue patches. Tissue patches, can you show you next one? Okay, here are examples. So on digital pathology, you look at under the microscope, we have a glass slide. That glass slide is scanned into a scanner to convert this glass slide into a digital image. Because the digital image is too large for our algorithm to calculate, then we slice them into a small tile or patch to do that. So that's why we see the patch or tile. Same thing here from this article. They use 100 million tissue patches, and they have like 100,000 diagnostic HE whole slide images, and 20 major tissue types and 108 cancer types. They use this to develop their computational pathology foundation model. The one thing is quite interesting from this article, they use a lot of heart pathology image. Heart really is an organ, doesn't have many pathological changes. Really kind of puzzling to me how they use that many heart on that. But anyhow, they did this, develop this foundation model and test their model against the state-of-art individual algorithms in different tasks. That how they show their excellence. Their model called UNI, UNI. They use a technique called self-supervised learning, SSL. That's different from supervised learning. supervised learning that is quite expensive in healthcare because supervised learning means you need to give labeled data for individual cells or individual organs. You need someone to come here to annotate, to label that image, which is time consuming and labor intensive. Because of this, and the self-supervised learning become more and more popular because this doesn't require label data, and the computer can learn from its own and to know how to classify, segment the medical images. That model was from MIT and Harvard, and this model is from Page AI and Microsoft. It's called Virtual. In the million slide digital pathology foundation model, they use 1.5 million whole slide images and 632 million parameters. So they showed how they do the workflow for their model development. And there's a task. They do slide level classification and also do tile level segmentation and to even do the prediction. So anyhow, if you look at this table, it shows that this is the model Virtual, and this UNI model, the model which I talk about from MIT and Harvard. And there's another model, C-TransPath, is a foundation model. So this show the Virtual outperformed all other models in all the tasks in the test. But just 1 week or 2 weeks ago, there's a new foundation model come from Mount Sinai. It's a computational pathology at a health system scale, self-supervised foundation models from 3 billion images. And so you can see that the more and more images were being used. So this here is a comparison of the major large pathology foundation models. So it have been used. And here is this model in this article, how many tiles, how many patches they used. And they used from the Mount Sinai healthcare system. So that's breakdown of these different pathology models. And will this be the last one? Absolutely not. We're gonna see more and more large foundation models coming out. Yeah. Then there's also large models to combine the pathology and the genomics, like a multimodal foundation models. You can show here. How about radiology? I mean, radiology, definitely someone have to develop a large foundation model, right? This model was from Shanghai, and they put all different radiology images and different systems into their foundation model. Here, this comparison of their performance against the other algorithms. So we have now the large models for language in medicine. We have large models for pathology. We have large models for ophthalmology. We have large models for radiology. Now we have so many of large models. Actually, you can do a lot of things with large models. It's called like the blender. The blender, more like think you can take these different models, put them together in a synergy to work. And there are different techniques like that. You have the knowledge distillation. You can have this ensemble, different ways for you to do it. Just think about this can be as a flexible as a Lego system. So this was a 2022 trend I put there. But for the 2023, I should put it as a 3 here. That is a trend is a super large and the foundation models will come. That will be the growing area for our future AI in medicine. That's what I think is gonna happen in future AI. When we ask questions to ChatGPT or Medipalm or other articles, we type in the answer. We type the questions. Even for the pathology model, we have to feed the image to that. So it's a very manual process, but it's not hard for our system to imagine a world in that all this medical information, including the laboratory test, the radiology image, pathology image, and the genomic test, all fit into a super brain of your system. And this system automatically just process this information and give you suggestions about the treatment or diagnosis. That's what I call the platform as AI. That here, the platform as AI is gonna happen. Right now, the challenge is really our healthcare information system is so outdated, and is not compatible with to incorporate these large language models. But meanwhile, to just get rid of this healthcare information system is so expensive. So we can like in a kind of dilemma. But that will be overcome over time. And that's what I think is my belief what's gonna happen. You're gonna have this super brain that is the generalizable large model to digest all the information for different patients and then put them together, give you the best answer. This answer will be better than any of doctors, because we as a physician, we are expert in our field. But if for me to do any like a surgeon's work, it's impossible. But the GPT has no subspecialties. They can know all these medical fields. So it's like the keyword really here, integrated GPT. And with every doctor, AI partners. So it's what I believe. No matter what kind of patient you're gonna see here, in the future, you're gonna be a AI doctor stand behind you, either like remotely or just at your side. Actually, I create this image and this slogan using ChatGPT. I just give ChatGPT description. I say, you know, what kind of image I want to create an image for me. That's what ChatGPT came out for me. Not bad. So that's what I talk about, the big picture and the state of the art of AI in medicine today. Next year, gonna be more monumental, and I don't know what to expect, but I'm sure something gonna be more breathtaking gonna happen. But how soon that breakthrough is gonna impact our practice? That's a good question, and I think it's gonna take a while. It's for many reasons, right? Because we practice like in a real world with a lot of limitations from the system, from the financial, from the insurance, a lot of barriers to really adopt this technology. Another thing to keep in mind is that the regulatory and ethical considerations of this new technology also needed to be put in consideration. It's a patient's privacy with a fairness about this AI technology, something that we have to keep in mind. Although there's no good answer to any of these questions, but there's important questions for us to ask. Okay, that concludes my today's talk. I'm happy to answer any questions. Thank you.
谢谢于医生，这个讲座有一部分我是听懂了，非常非常棒。我们非常感谢于医生。现在于医生能够看到 chat box 里面有一些 comment， 还有问题吗？
我看一下 chat。
对，我们
some comments about technical issues about the audio.
Oh yeah, you can skip those. There's no problem. There was no problem anymore.
Yeah, so right. The hallucination was mentioned in a Jensen article about using ChatGPT. Yeah. Yeah, 以我的经验，我自己有时候问 ChatGPT， 我问了以后，他给我胡说八道，我能看得出来，就是我能知道。但我回答我得讲说 That's not right。他们说 Oh, I'm sorry, I'm wrong。然后他又给你个新的 answer。Definitely the hallucination part for sure. Yeah, source and click. We know of the source. There's a large data called a web crawler. Basically, what they do, they just like write a program. The program goes to different websites, collect all the information back, and that is the major source of a large language model training. There's a different website saying, okay, they're gonna shut down the crawling of information gathering. So they let you to collect any information you want. From now on, they said no. One reason is because ChatGPT. All these websites failed that ChatGPT uses their data to develop their model and make themselves rich, and they didn't get a fair share for the data they have. Also, there are recent voice from different authors, and because these language models trained on some fictions, some novels, and then they know that they use their work, the author's work, but also said, okay, you didn't ask me for permission. Number two, I didn't get any compensation for the work. So that is definitely the problems with the training of a large language model. How do you think about Neuralink? Does it have a good potential or just have? I'm not very familiar with this Neuralink, so I cannot make a comments on that. Yeah, I can check later, but I don't have any answer this moment. That's all what we have.
Yeah. 大家看，如果有什么想需要讨论的还有其他问题的话，大家可以打开自己的话筒。如果有 comment 有问题，可以跟于医生一起讨论一下。我们现在还有一点时间。这样哈，李明，我觉得这个从我自己的一点这个疑惑哈，还有想法，这个就 for example ChatGPT， 大家现在都已经开始用了，我也有过一些 experience， 但是就是说你 search 找到一些 feedback， 然后long term， 我如果用这些 feedback 这些 answer， 再把它 release 到internet, right? And so this is I don't know, a few years later, there are data generated by ChatGPT that are being reused, are being self-fed to ChatGPT itself.
Yeah, good question. Yeah, this is a good point, and that definitely is a very legitimate concern. But ChatGPT can generate so much information. That information can be reused by other models to train. That definitely is a concern. Yeah, absolutely.
Yeah,
there's
the accuracy, right, of those data and the conclusion over time would be sabotaged.
Yeah.
So,
and there are some proposal technical things, like they can put some kind of signature into their answers. The signature is not recognizable by human beings, but definitely can be recognizable by computer. But it's easier for image and then for the text answers. But even for images, there's many ways to bypass that restriction. So we don't have a good answer to that, but definitely something to think about. Yeah.
我们现在有一位举手的听众，请你可以 unmute yourself, Jimmy, right?
Yes. Yes. Can you hear me?
Yeah,
Yes.
I can hear you.
Awesome. Thank you, Dr. Yu. That was a great presentation. My questions are in two parts because I'm very interested in medical imaging. So I know that currently in clinical trials, what people are still using human clinicians to analyze imaging data for clinical trials to approve new drugs. But there's a lot of variability associated with that. And I feel excited by the possibilities that AI can offer. But I also don't know how this can affect the extent to which physicians can be involved in clinical trials in the future. And within that context, would you recommend that newer radiologists or pathologists to have a degree in computer science or in AI to still provide value in this industry?
Yeah, the good question. Actually, that involves that just related to my day-to-day work. I do a lot of model training, mainly on the digital pathology, and also we do annotations on the image, and sometimes we do it ourselves, and sometimes we use other pathologists as expert to take the ground truth. The ground truth has, we take it as literally as the ground truth, but in the reality, it's not always the case, because there's inter-observer discrepancy, discordance, and sometimes we have to take multiple annotation on same area or same thing, so we can take a consensus as ground truth. Even so, it's not always the ground truth is not guaranteed. But actually, computer can sometimes do a better job in the areas we have inter-observer variation. Just 2 days ago, the company I work for just released a virtual device for NASH, non-alcoholic steatohepatitis evaluation. That's the first of this kind that we developed that algorithm using for NASH clinical trials. Because FDA use some pathological changes as the end result for drug evaluation, that including like a ballooning of the hepatic cells, inflammatory or the fibrosis. But for pathology to do that evaluation is very challenging because sometimes it's so subjective. But actually to have a computer system to do the assessment make a lot more sense. And because it's not as subjective as others. And so we're very excited by that. And we're gonna do more work like this. Then I hope I answered your first question. Now I'm going to answer your second question. It's a really tough question to answer. And because the future is
I apologize.
No. It's a good question. I mean, it's a good question. I feel like I have a background in computer science, but I still feel I have so much more I don't know. I wish I have known, but I don't know. But I think to have some literacy in computer science, or at least in AI or machine learning, will be very helpful. You don't have to know all these nitty-gritty details about how we develop model, but you should know something how the model is trained, or what the data is considered like training data, what the test data, how to break them down, and what's the multifold across training. If you know the terminology, it's going to help you a lot, because inevitably in the future, as the young generation of physician, you will work with engineers. And even if like for example, GE come to you say, okay, we just released a new AI model, and it is, here is the performance. And if you can critique their data, you try to understand what behind the data, that really help you. Otherwise, you can just take whatever they tell you. So that's how I see that. So I think to have some kind of literacy in AI machine learning area will help you a lot. Particularly if you're young, I just say pick up this field. And it's kind of a little bit very different from our training as a physician. But once you pick up the basic, and it's become less and less challenging, and you can just get the momentum to build up. Yeah.
Oh, okay. Thank you.
Yeah, thank you. We have Lauren.
Thank you. And then I have Dr. Go ahead, Peng.
Laura. Oh, hi.
Yes.
Hi. Thank you. Great talk. Thank you for the talk. I learned a lot. So I'm a radiologist and you're a pathologist. So it's a very much so the two fields. The common people have a common question is you are going to be replaced by AI. So my question for you is, I'm a big proponent for AI. I think it's going to do a lot of work for us and help us. It's going to make me a better radiologist. However, for the younger generation who is going to go into medicine or into this field or in the bigger picture, what's the human role in this future development? Like, where is the human interaction play into this entire discussion? Or make it simpler questions. What do you tell the kids who want to become a pathologist and radiologist?
Yeah, that's a great question. I think when we see like whether AI gonna replace us or not, actually it's a question of multiple levels. I mean, it's difficult to give yes and no answer, because the AI gonna replace our work, some of our work for sure. For example, as a dermatopathologist, I count mitotic figures on the slide when I make a diagnosis of melanoma, because that has a prognostic value. In the future, the AI can do that for me. That's gonna replace my work for sure. And I can also see many, like right now we do like a HER2 PD-L1 assessment for the biomarker patient stratification. But in the future, that will be done automatically by a computer. So that humans part will be gone for sure. And but that doesn't mean it's gonna replace our occupation or profession. But the important thing is for us to go with the AI. AI is very powerful, but we have to know how to improve ourselves with it. More like you have a dragon, but know how to ride a dragon, just as important. And to say, okay, for the future radiologist or pathologist, I have to see like in medical field, there are some specialties will have more direct impact than others. Like radiology and pathology are the two things I can think of right now. And just see if I have a kid of say that, okay, I want to be a radiology pathologist. I'll probably say, okay, yes, you should pursue that, but knowing what you are getting into, you're gonna have to learn how to dance with AI. And that is totally different from our traditional medical education. And that's totally different. And you have to know to do that, but maybe not necessarily bad things. Think about like genomics. And the 20 years ago, we don't have the field, but now we have genomics. And by the pathologists and oncologists, we learn how to incorporate that into our practice. We can move, build upon that. A same thing, I think, for AI, but definitely it's more challenging. And a lot of unknowns and a lot of uncertainties, for sure. Then also you mentioned that what's the human part into model developing. I would see the sad effects for physicians. We actually, I think we become less and less relevant to some extent. I don't mean to encourage everybody here, but I do feel so. From my work, when I develop model, and I see once the model learns itself, actually it relies less and less on humans. And all these computer engineers I work with, at the very beginning, they don't know nothing about the pathology. Through the work, I teach them, I train them. Eventually, they pick up some language. They can build on themselves much faster, and that's just the reality of the world going to be. But the good things about here is, as in the clinical practice, and we're working with the patients, so that is different from model development, and so that is important. That's nothing. Nobody can replace us from there. But the communication, the conversation we're gonna have with the patient will be different too. I don't feel I give you the best answer, but I just that's all the best I can do. I'm just feel sorry about that.
No, thank you for that. I don't think there's an easy answer for this. We're all searching for answers here.
Yeah, definitely. It's no easy answer for that, for sure. And yeah.
Yeah, great. Yeah, that's a great discussion. It's indeed a uncharted water that we are sailing into. So when I saw almost the last picture from Dr. Yu's presentation with this super brain for a ChatGPT in the center, it feels like exactly the same question that Dr. Lauren Peng asked. It's like, what's our role in this? It's like that's a supermodel, a multidisciplinary model that the machine can take on, and it's almost like a super being, comparing to a human being. Like we serve the machine now, or the other way around. So it feels a little threatened, indeed. Like it's a dragon. Are we driving the dragon, or it's like the other way around? But
yeah, definitely. It's a very exciting time, but meanwhile, it's a lot of uncertainty here. But as individuals, just leave our profession aside, I think we are going to benefit from AI for sure. But the impact to our profession, I think is overall positive. But then the impact on individuals can be good, or sometimes can be bad. It depends in terms of your job stability and financial income. I don't know this part, but I think overall going to help us. But there's many things we don't know.
Great. Yeah. So let's see do we have any more questions from the audience? We're almost concluding our night. So, all right.
I do have one more question, if that's okay.
Sure, of course.
Yeah, so you mentioned that prompt engineering is a very important skill now, given the large language models. Can we ever create an AI that can do prompt engineering for us, that translates human language into optimized prompt? Okay.
Yes. There's apps. If there's a ChatGPT 4, you can turn on different the apps. One app is called a Perfect Prompt. You can do that. And sometimes, for example, the image I made for this one, actually I asked ChatGPT, I said, ChatGPT, give me the prompt for me to make this image. And ChatGPT gave me the prompt. I just tune up a little bit and then ask GPT again. I said, okay, because GPT has their has this another app called DALL-E 3 that's also from OpenAI, and is for the image drawing. I just asked me to give me the prompt for this app. So yes, you can do that. And you can, for example, you can ask like the chain of thought idea. You can have the different give the prompt different steps, step by step. Just ask like how to explain the USMLE answer. You give step by step. You can do that. So that will be very helpful. Yeah. But another thing to keep in mind is that the prompt engineering is continuing changing. What you learn today, what is work today, will not work tomorrow. But I think it will not work tomorrow because of what you don't need that much engineer. The computer, the AI gonna get better, understand you. But something just to keep in mind. Nothing is for certain, for sure.
Thank you.
Yeah.
Great. Yeah, so if we don't have any more questions, we're gonna conclude tonight's talk. Thank you so much again, Dr. Yu. It's such a pleasure that we can invite you to give us such a wonderful talk, right? So
thank you very much. Yeah, thank you everybody's time. I appreciate it. Yeah, all the good questions. Yeah, thank you, Jeannie. Thank you, Laura. Yeah,
and this video will be on our website at the latest tomorrow. We'll put up the video link. All right, everybody has a good night. Okay,
yeah, thank you.
bye, guys.
Bye-bye.